Spotting lung cancer early. 12 warning signs you should know. Lung cancer is a serious and often deadly disease that affects millions of people worldwide. While it is commonly associated with breathing difficulties, there are many other symptoms that can serve as warning signs for this type of cancer. In this video, we will discuss 12 surprising symptoms of lung cancer that you should know. While these symptoms may not necessarily indicate lung cancer, being aware of them can help you catch the disease in its early stages and increase your chances of successful treatment. Together, we can work towards spotting lung cancer early and improving outcomes for those affected by this disease. Just a quick reminder, we are not doctors. This video is for informational purposes only. If you have any symptoms or doubts, always consult your trusted healthcare provider. Risk factors of lung cancer. Understanding your risk factors can aid in early detection of lung cancer. Firstly, smoking is the leading cause of lung cancer, accounting for 80 to 85% of cases. Living with a smoker, even if you are not one yourself, can still expose you to secondhand smoke, raising your risk. Exposure to certain chemicals like radon, a naturally occurring radioactive gas, can also contribute to developing lung cancer. Other risk factors include having a family history of lung cancer, being age 65 or older, and exposure to certain occupational substances like asbestos. Furthermore, individuals with a history of lung diseases such as chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis have a higher chance of developing lung cancer. However, it's crucial to remember that risk factors are not definitive predictors. Many people with these risks never develop the disease, and conversely, many without these risk factors do. Now, let's dive in and learn more about early indicators of lung cancer. 1. Chest pain. Experiencing chest pain could be a significant sign of lung cancer. This discomfort can result from various reasons such as the presence of tumors, enlarged lymph nodes, or even a fluid buildup in the lungs. It's crucial to note the characteristics of the pain you're feeling. Is it sharp or dull? Is it a constant throbbing pain, or does it come and go? Significantly, does it intensify when you breathe in deeply, cough, or even laugh? Please don't ignore or underestimate chest pain, as it could potentially be an early warning sign of lung cancer. 2. Bronchitis, pneumonia, or emphysema. Chronic conditions like bronchitis, pneumonia, or emphysema that persistently linger or recur may signal lung cancer. Various studies have pointed out possible correlations between these conditions and lung cancer. Symptoms linked to bronchitis or pneumonia, such as a persistent cough, labored breathing, low-grade fever, chills, and discomfort in the chest area, can often be mistaken for these conditions, but might, in fact, be signs of lung cancer. It's crucial to pay attention to how your body responds over time. Remember, early detection can significantly improve the prognosis for lung cancer. 3. Bone pain. Mysterious aches and pains that don't seem to have a clear cause could be a warning sign of lung cancer. While it can be challenging to differentiate between bone and muscle pain, a few indicators might suggest bone pain. If you notice the pain intensifying with movement during the night or while lying on your back, these could be signs that the pain is emanating from your bones rather than your muscles. Lung cancer, although less common, can cause pain in the shoulders, arms, and neck. This pain often results from cancerous cells metastasizing or spreading into the bones. The most commonly affected areas are the spine, pelvis, and the upper bones of the arms and legs. 4. Hoarseness. Has there been a noticeable change in your voice? Perhaps it sounds raspy, hoarse, or even unusually high-pitched. These alterations could be a potential warning sign of lung cancer. The vocal cords, which create sound by vibrating open and closed, can be affected by lung cancer. Specifically, this type of cancer can impair the functioning of the nerve responsible for initiating this vibratory movement of the vocal cords. However, keep in mind that hoarseness and changes in voice tone are also common symptoms of various other conditions, including laryngitis. Therefore, while a change in voice quality could be an indication of lung cancer, it is essential not to jump to conclusions without further examination. 5. Breathlessness or shortness of breath. Experiencing shortness of breath or feeling winded may be a red flag for lung cancer. particularly if you notice breathlessness during activities that didn't previously leave you gasping for air. It's essential to take note. For instance, climbing a flight of stairs or carrying groceries may now seem more strenuous than usual. This change could occur because a tumor is blocking part of the lung, making it harder for air to flow, or due to fluid accumulation in the chest related to lung cancer. Importantly, breathlessness can also be a symptom of many other health conditions, not just lung cancer. 6. Drooping eyelid, Horner's syndrome. Lung cancer can occasionally interfere with nerves associated with the face and eyes, resulting in a condition known as Horner's syndrome. This condition is characterized by a drooping, tired-looking eyelid on one side of the face, a smaller pupil, and an absence of sweat on the same side. Pancoast tumors, a specific type of lung cancer, are particularly known to cause this symptom. It is a noticeable change that is likely to be picked up by your friends, family members, or even yourself when looking in the mirror. 7. Finger clubbing. Finger clubbing, a peculiar symptom of lung cancer, is characterized by the swelling of fingertips which become broader and rounder, while the nails curve more than usual. This alteration in finger appearance can be attributed to the secretion of a hormone-like chemical by the tumor. This chemical propels an increase in blood and fluid flow to the finger tissues, causing noticeable changes. Astonishingly, it is estimated that around 80% of finger clubbing instances are associated with lung cancer. Given the high correlation, it's crucial to not disregard this symptom. 8. Puffiness in the face, arms, and neck. Occasionally, lung tumors may obstruct the superior vena cava, which is the primary vein responsible for transporting blood from the upper body back to the heart. This obstruction prevents the blood from flowing freely, leading to a buildup in the head, neck, and arms. As a result, swelling or puffiness becomes evident in these areas. The severity of this swelling tends to intensify as the condition progresses, starting in one region and gradually extending to others. In some cases, this blockage may also cause a distinctive bluish-red discoloration to appear on the chest. It's crucial to keep in mind that this swelling isn't necessarily restricted to the morning or evening, but could persist throughout the day. 9. Stomach aches not associated with diet or a virus. Unexpected and persistent stomach aches that can't be explained by your diet or a viral infection might be a sign of lung cancer. In certain circumstances, lung tumors can secrete hormones that mimic the function of the parathyroid hormone, which is responsible for controlling calcium levels in the body. This artificial parathyroid hormone can induce an excessive amount of calcium to be released into the bloodstream, a condition known as hypercalcemia. High levels of calcium in the blood can cause stomach aches, constipation, and a general sense of discomfort. Along with these symptoms, you may also notice a sudden loss of appetite. This symptom isn't exclusive to lung cancer and can occur in various other health conditions. However, persistent stomach aches unresponsive to conventional treatments should warrant a checkup to rule out potential serious illnesses, including lung cancer. 10. Frequent urination and thirst. If you're noticing an unexpected increase in your trips to the restroom coupled with an insatiable thirst, don't dismiss these symptoms. They may be related to lung cancer, specifically due to a condition known as hypercalcemia. With hypercalcemia, an excess of calcium in your bloodstream forces your kidneys into overdrive, trying to filter it out. This extra exertion on your kidneys manifests as frequent urination. The more you urinate, the more your body craves hydration, leading to persistent thirst and potentially even dehydration. However, these symptoms are not exclusive to lung cancer and can be associated with a range of health conditions. 11. Achiness and weakness. Do you find yourself feeling unusually achy or weak without any clear explanation? This could be a warning sign of lung cancer. In some cases, lung cancer can spread to other parts of the body, such as the bones. When this happens, new tumors may form that damage the bones, increasing their fragility and leading to a sensation of persistent aching. The general feeling of weakness is not uncommon either. Lung cancer can induce a condition known as hypercalcemia, which is characterized by excessive amounts of calcium in the bloodstream. This excess calcium can lead to widespread weakness, often accompanied by pain. Early detection of lung cancer can significantly increase the chances of successful treatment and survival. So never underestimate the importance of paying close attention to even seemingly minor changes in your overall health and well-being. 12. Wheezing. Wheezing is a high-pitched, whistling sound that occurs while breathing. It's usually more noticeable during exhaling and can be a cause of concern. This audible symptom arises when the airways become constricted, obstructed, or inflamed. In the context of lung cancer, a growing tumor might impinge upon or entirely block an airway, resulting in wheezing. Other conditions like asthma or allergies are also known to cause wheezing, but they are usually more benign and treatable. However, it's essential not to write off wheezing as a symptom of these conditions without a proper diagnosis. It's always better to seek evaluation sooner rather than later, as lung cancer symptoms tend to intensify with the progression of the disease. Keep in mind, though, we are not doctors, and this information should not be considered as medical advice. This video is for informational purposes only. If you found this video interesting, I invite you to subscribe and check out our video on 12 early signs of colon cancer you should know.